Yeah, non-communicable diseases, which I will just refer to shortly as NCD, non-communicable diseases. It is true it is on the rise in this country. We have seen the rising burden in the last decade, in the last 10 years, where it has almost doubled. Non-communicable diseases basically refers to diseases or conditions that are not easily transmissible or transferable from one person to the other one. For instance, we can't say if I sit close to you, I stay close to you, we eat together, you can get it. No. So these diseases are usually referred to as diseases of lifestyles because they are mostly related to the way we live, the way we eat and probably drink. So it is basically lifestyle diseases, although there are others that are not directly linked to lifestyle, which I later on talked about. So these diseases include conditions like high blood pressure, heart failure, heart disease, stroke, which is very common, cancers of any type, cancer of the breast, cancer of the cervix in females, cancer of the prostate in males, cancer of the skin, and other different forms of cancers. And it also includes diseases like diabetes, which occurs also in children, the type that's called type 1, then the type 2, which is common in adults and is related to our behavior and lifestyles. And then diseases like chronic respiratory diseases. These are diseases of the airway. That brings the narrowing of the airway and a lot of difficulty in breathing. For example, we have diseases like asthma, which is commonly known. And then we have mental conditions like anxiety disorders, we have depression, we have suicide, and many others. I just wanted to mention the commonest, the ones that people are very conversant with. And then we also have injuries. By the way, injuries is also non-communicable diseases. Any type of injuries due to violence, due to accidents, the ones that is self-afflicted, it is also one of the NCDs. And then there are others that are not directly related to lifestyles, like sickle cell disease. Sickle cell disease is mainly inborn. You acquire it from your parents if they are carriers. So that is also one of the conditions that is very, very common and prevalent in this country, especially in the northern part of Uganda, eastern Uganda, and Soroti generally. This is part of the high prevalent districts. And then we come to Busoga region and then the central region. And these are the commonest. But we also have others like chronic kidney disease that is also linked to either diabetes, also linked to hypertension, high blood pressure, and also other conditions that brings kidney problem or kidney failure. So the list of non-communicable diseases is quite diverse. It is quite long. It's very, 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 very big. And what I've mentioned is just a few of them. And in Uganda, non-communicable diseases accounts for about 33% of the deaths that we see in our facilities in the country. 33. So 33 out of 100 deaths that you see is attributed to non-communicable diseases. And if we are to add injuries on that statistics, then the number goes after around 41%, people dying as a result of non-communicable diseases. Now, one may be interested in knowing what are the risk factors for developing these non-communicable diseases. So the risk factors includes one, aging. As you may be aware, the population in Uganda is now living much longer. In the past, the life expectancy was around 30-something to 40. But now people live up to 60 years. So as you age, we tend to develop non-communicable diseases because of the aging process. The body systems and the organs weaken. Then number two, we have what we may call genetics. This is the type of NCD that you can inherit from your parents, can pass on to the child, like type 1 diabetes, like sickle cell disease, which I mentioned. just to give you a few. Then another factor is infections due to germs. This is common, especially like cancer of the cervix is attributed to an infection. Then HIV virus also brings some cancers that is related to that infection. And there are other types of infection, like the one that affects the heart, especially in the young children, what they call rheumatic heart disease. Is also due to infection. That infection starts like pain in the throat, painful swallowing. I think this is a very common thing that people usually are very conversant with, especially in childhood. So that pain may go away, especially if it's not well treated, but over time, it continues coming back, disappears, it comes back. But as the body fights that infection, the body, there's what the body produces to fight the infection. That same thing also affects the heart, and you end up developing heart problem. So that is due to infection, just to mention a few. But the other factors like stress affects the entire body system, can also lead to NCD. Then the air quality. Poor air quality mainly leads to diseases of the airways. Both indoor air quality, like those who cook using charcoal stove, poor ventilation, a lot of dust and all that brings in that. But we also have outdoor air pollution due to exhaust fumes, smokes from industries, wildfires, and all that, bush burning. But the most important one is the lifestyle conditions. Lifestyle, the way we live. Now, currently, ladies and gentlemen, and our listeners, people tend to eat food that is not healthy. Food that is very high in salt, with a lot of sugar, high in sugar content, any kind of sugary drinks, name it, whether tea, high in sugar, food that is high in bad fats. There's fats, especially animal fats. Most of them are really not very good. Any fat that is solid at room temperature is not healthy for human consumption. And foods that is, we tend to consume foods that is very low in vegetables, very low in fruits. Much as we grow most of these, we end up selling some of these items. So that is unhealthy diet, number one. Number two, alcohol intake or alcohol consumption. Ugandans consume a lot of alcohol. Actually, about 32% of adults in Uganda consume alcohol beyond the normal limit, and that is quite dangerous. Another risk factor is tobacco, use of tobacco and related products. We know tobacco affects the entire body, starting with the airway, the lungs, and the rest of the body system, including the heart. So, according to the study that we did in 2023, 8.3% of adults in Uganda use tobacco or any form of tobacco-related products. All tobacco in its form, different types, whether shisha, whatever it is, they are all dangerous, very, very dangerous. And tobacco is one of the most dangerous products that can kill the consumer or the user when you use it the way it is supposed to, the way it is prescribed by the manufacturer. It kills you. So this is what people should take note of.
Now, and, doctor, just on tobacco, you've raised the issue of tobacco, and in Uganda we have the tobacco control something. There's a law that prohibits.
Yes, exactly. We have Tobacco Control Act. We have tobacco control regulations in place. We are trying to implement this, but the Act mainly prohibits smoking in public places. And we have seen a lot of improvement, a lot of changes in that, but still people say, go ahead and consume tobacco. But in institutions, we see the young people, there's another version of it, they call it shisha and all those kind of things. They imagine it is not dangerous, but it is equally dangerous. So tobacco is the only product that does not have any nutritional value. You take it, but it does not add any value in terms of nutrients into the body. Instead, it ends up causing more harm and damage to the body. Physical inactivity. Generally, in Uganda, about 3% of the population are physically inactive. They don't engage in any form of exercise. These are people who are in urban centers, the working class, the business community. They wake up in the morning, either they use a border or they drive to the workplace. They remain seated most of the time. They come back home when they're tired, they eat, they enjoy their drinks, and they sleep. So this is very, very dangerous. 3% of Ugandans are physically inactive. Now, what are we doing about this? Number one, we did a study, of course, to get the prevalence, to know the burden of these diseases in the country. And we already have the information. And we are using that information for planning and programming. Number two, awareness creation. And I must commend you for inviting me to talk about this so that people get to know how serious the problem is. We need to create awareness. People are not aware of the lifestyles that are risky. So it is important that we continue telling them that, hey, this is not how you should live. Please abandon. You eat well, avoid alcohol, avoid tobacco, be physically inactive, reduce on the stress that you have, ensure that your environment is clean, the air quality and all that. So these are very, very important aspect of prevention of non-communicable diseases. Now, apart from awareness creation, you may be aware that this is relatively a new area. So we are doing a lot of advocacy with the different stakeholders so that we also introduce other regulations, other measures to restrict some of these, consumption of some of these dangerous products. This is something that is in process. For instance, the Tobacco Control Regulations, Tobacco Control Act came as a result of that. Now we have Alcohol Control Bill, which is in Parliament. This bill is going to be very instrumental in controlling the advertisement, the access to alcohol, especially to those below the age of 21 years. And beside that, we are building capacity of our health workforce to deal with the condition, especially those already living with NCDs, so that they better manage these diseases and they don't progress into complications and they don't end up dying as a result of that. We are also strengthening general the health system to be able, apart from capacity building of the health workers, to be able to manage non-communicable diseases in the country. So briefly, this is some of the things that we are doing. Right. We are working on a number of policy documents. We are working on a number of regulations. We are working on a number of treatment guidelines. We are working on a number of, things that would make management of non-communicable diseases easier for our health workforce.
All right. Now, Doctor, thank you so much for speaking to us. We'll get back to you next Tuesday, and we'll be able again to digest in terms of statistics. You've talked about, you've outlined to us a number of diseases that are termed as non-communicable diseases or NCDs, and I would love to come back to you again next Tuesday and we speak about them in depth in terms of statistics, which one is ranked more deadly, which one is number one, which one, like that in that order. But for now, I would want to take your last message.
All right, thank you very much. So my last comment is that I encourage our people, our community to always lead a responsible lifestyle. And please do a regular health check and so that you determine your health status, whether you have NCDs or not. And if you have, you should go to qualified health workers and get appropriate treatment. Non-communicable diseases is not due to witchcraft. Some people believe that some of these conditions are due to witchcraft, like sickle cell disease and so on, and they end up wasting a lot of time going to people who are not qualified. In that process, they develop complications or they even die. So please, let's be responsible, and the responsibility starts with each and every one of us. We can together prevent and control NCDs if we change our lifestyles.